Hi, my name is Marissa Gilman, and I lead Global Health at Resonance. You're tuning into the 7th episode of the Inclusive Innovation Exchange. And in this conversation, we'll chat about novel partnership models to increase access to non-communicable disease care. I'm here with my co-host, Chantal Akanyemi, who's a senior analyst at Resonance and our platform manager for the Inclusive Innovation Exchange. This discussion features James Fitzer, Director of Access Accelerated, Javier Lozano, co-founder and CEO of Clínicas del Azúcar, and Dr. Hien Lee, Program Director at PATH's Vietnam Country Office. In this episode, we're going to look at how 3 organizations are pioneering novel approaches to promote access to care for non-communicable diseases. And for those who haven't checked out the Inclusive Innovation Exchange, here we explore opportunities, successes, and lessons learned by global health innovators. Our goal is to inspire and connect people and organizations using innovation to maximize impact and promote sustainability in emerging markets. And for us, inclusive innovation is key, and also the definition is important, which we define as innovations that are local first, human-centered, and grounded in partnerships. As I mentioned, we've had about 7 episodes to date. Interviews and recordings are published on our website, which we'll link in the chat.
And during the conversations for this series, we strongly encourage questions from the audience. So please submit any questions you have for the panelists via the Q&A button on the Zoom screen. We'll select a few questions during the last 15 minutes of this conversation to pose to the panelists. So I'll let Marissa take it away, and I'll be back to moderate the Q&A.
Great, thanks, Chantal. I'm really excited to introduce our guest today. So as I mentioned, we have James Spitzer, who's the Director of Access Accelerated. He leads overall strategy and implementation for this collective industry effort to address inequities in NCD care. We also have Javier Lozano, who is co-founder CEO at Clínicas del Azúcar, which is revolutionizing diabetes care in Mexico through a network of 18 low-cost, one-stop shops for diabetes care. Then we also have Dr. Hien Lee, Program Director at PATH's Vietnam Country Office, who brings a remarkable track record of progressive leadership in government and international organization settings for NCDs. Thank you all for joining. So to start, I think it'd be great for the audience to get a sense of the work that you all are leading in this space. And each of your initiatives represent a different approach to tackling NCDs. And I'm curious if you each could share a bit with everyone about your organization and the work you're doing in this space. And James, perhaps we can start with you, and then we can move to Dr. Lei and then move on to Javier.
Super. Thank you very much, Marissa, and thank you very much to everyone. On behalf of Access Accelerated and my member companies, I'm really honored and delighted to be a part of this really important discussion. So thank you very much. My name is James Fitzer. I lead the Access Accelerated initiative. As Marissa said, we are a private industry, public-private partnership that made up of 24 global biopharmaceutical companies. And what we've tried to do is pool our resources and expertise to see how we can become meaningful solutions-oriented partners in low and middle income countries to help to reduce the barriers to prevention, treatment, and care for non-communicable diseases, but also taking into consideration the impacts of the current COVID pandemic, recognizing that it's people living with NCDs that bear a disproportionate burden of the impact from the COVID pandemic. We're seeing how to pivot our ongoing investments to help mitigate impacts from the COVID pandemic as well. Thank you.
Thank you. And perhaps we can move on to Dr. Lee.
Hi, everyone. My name is Hien. I am working for PATH in Vietnam Country Office. And it's my honors to be here. We can share the work we have been done at the global levels, and especially in Vietnam. And PATH is some introduction about PATH. PATH is an international organization, has been working for the health and development many years. And for NCDs, for non-communicable diseases, we have been working since the 1990s, and currently has the NCD project in more than 10 countries. PATH has been working for NCD in Vietnam in 2016 with the Community for Healthy Heart project, supported by Novartis Foundation, and in partnership with Access Accelerated. and James is a director present today. We are implementing the community for healthy Vietnam, and we expand the successful primary healthcare models to the new two more regions in the country that allows in the increased screening and linkages to care for diabetes and hypertension. And our programs are aimed to reach people with within the community where they live. And we have introduced screening in the easy access points, including the community checkpoint and the market and drugstore and even like a hair salons. We can people can easily access those services. The Community for Healthy Vietnam programs approach focuses on the three main components. The first one is stronger primary healthcare systems. The second is strengthening the supply chains. And the third one is a data-driven decision making. And we hope during our webinar today, we can share more the story have been implementing in Vietnam. Yeah, thank you.
Thank you, Hien. And Javier, would love to learn more about the work that you're leading.
Thank you, everyone. Good morning. So, I started Clínicas 10 years ago while I was in MIT, and I was getting involved in a lot of technologies for diabetes care in Tanzania and in Boston. And then I saw firsthand with my mom the struggles, and she was getting so exhausted from moving to one place to another one just to deal with her diabetes. So that was the idea behind Clínicas del Azúcar. It's a one-stop shop. It's a one place, one price. And right now, currently we operate 18 clinics. We have served 150,000 patients. Basically, we're the largest private provider of diabetes care in the country. But most of all, about 75% of our patients are middle and low income. So we were able to highly increase access to not only the 10%, but to the vast majority of the country. Just to give a sense, typically in Mexico, it costs about $1,000 a year to get specialized diabetes care, and we charge $300 a year. And so a huge decrease or cost savings. And the other thing is not only from the cost of treatment, but also from the cost of transportation. So when patient comes, we have stations. And so everything is in one place, one visit. So that allows not only to save on treatment, but also on time and cost of transportation. So that's the Clínicas, and expanding quite quickly. And that's it.
Great, thank you. It's really exciting hearing an overview of each of the work that you all are doing, and to really call out the distinct models that these three individuals represent. We have a public-private partnership through Access Accelerated. We have the work that Dr. Lei is leading in community health through an implementing partner through PATH, tackling diabetes and hypertension, and then we have a private provider model that Javier has designed. And so, I think through this conversation, our goal is to flesh out the differences and similarities in how each of these organizations think about collaboration and think about the work that they're doing to move the needle on diabetes and hypertension. And with that, something that's really core to the way that we think about inclusive innovation and the work that we do at Resonance is partnerships and collaboration. How do we work together to solve these pressing global health challenges? And NCDs, health doesn't happen in a vacuum. Partnership's really important. And so would love to hear from each of you the role that partnership plays in your models for tackling these therapeutic areas. Perhaps Javier, since you're off mute, I'm going to call on you first, but this is meant to be a discussion, so anyone, please feel free to chime in.
Excellent. Well, I mean, I totally agree. I think NCDs are, and just as James mentioned, it's a huge burden. In Mexico, it's a catastrophe. First cause of death, first cause of amputations, first cause of blindness. And I think it's nobody's fault. I mean, it's just how the demographics and the behaviors of all of us have changed. So it's a huge problem that we cannot tackle by ourselves. I mean, we cannot be an expert in every aspect of, and not only from the medical perspective, but just how NCDs are related to the everyday life. So just in terms of partnerships, I mean, I will say that we're pretty good at providing care within the clinic, but then we start partnered to see in other areas where we're not very expert. So we have definitely partnership with pharma, and we partner with almost all of them, and as we deal with many of them. And especially we have partnerships to create access and to better understand the just patient segmentations and just patients' desires. So we do a lot of research and think tanks about how just improve access. And then we have we built a very unique partnership with Deloitte. And in terms of, we capture more than 2,000 variables in our electronic health record. And it's a unique database because it's longitudinal. I mean, we have the patient at least for a year. So we know from the demographics, from behaviors, from outcomes. So we were wondering what insights can we get from data, and especially how can we innovate using behavioral science to continue to reduce cost and increase engagement. So we did a partnership with the Deloitte. We launched the Diabetes Notch Lab in the way how we incorporate behavioral science and just get more insights from the data that we have. Others, I will say that, well, I'm a Legatum Fellow, and MIT has continued to be a great partner from the Legatum. Also, right now, in partnership with Eli Lilly and Professor John Gruber from MIT, we just conducted an RCT to measure our health outcomes, and the other part is 90% of the patients have a huge reduction in A1C, and the outcomes from the study mentioned that we decrease above 1% from other alternatives. So it's a great model, but the question is, why, if 90% of the patients have a huge decrease in A1C, only 50% continue to the second year? So and now we're getting into a new partnership to create different studies and incentives and see what's behind most patients because in NCDs, if you do not improve, you abandon, but if you improve, you also abandon sometimes. So just getting more data and more insights about that. And of course, we partner with pharmacy chains and diagnostic. Just as most pharmacies, the challenge that they have is they get a lot of people with diabetes and hypertension through the pharmacy, but from other diseases, more like from antibiotics or just infection diseases, and they don't know how to tackle diabetes or just get the patient to start treatment. So we partner as well to see how we can drive more education. We can also learn from what will be the trigger in that case for patients to start treatment. So those are a few examples of our partnerships, and as well a few companies developing AI algorithms as well.
So it sounds like you, in terms of sectors that you've been working with, partnering with the private sector, partnering with various access sites to be able to increase the patient population that you're serving, and partnering in order to really understand the data component, to understand the impact that you all are creating. Dr. Lee and James, I'm curious for you both in your programs, how you think about partnership and collaboration, because each of those segments that Javier hit on, I think we can dive deeper into, but I'm curious, at a high level, the role that it plays.
I'll go ahead and jump in.
Yeah.
On behalf of Access Accelerated, I think partnership is really at the core of everything we do. We have 24 biopharmaceutical companies, and yes, we have technical expertise that we can contribute to meaningfully add value, but we really see ourselves as a partner around the table of broader stakeholders. And so what we do is we think globally, but we act locally, putting the people living with NCDs, really the patient perspective, at the center of what we do. Of course, me sitting in Geneva, I'm a long way away from, the low and middle income countries and the people that are actually living in the communities, but I am close to the World Health Organization, the big global discussions that are going on. So what we try to do is listen to the priorities that are articulated by big institutions like WHO, the World Bank, the UN Sustainable Development Goals, and then see how we can help to translate that guidance to the national level and then reaching through to the community level. Of course, course, everything that we do has to be in line with the national priorities of the Ministry of Health, and then working with different community stakeholders to make sure that we're adding sustainable and meaningful value. I think we try to create a platform to see who the best stakeholders and partners are, and then how can we catalyze and bring in new perspectives across broad geographies to share learnings. I think one example, and I'm so delighted Hien is here because we collaborate with Communities for Healthy Vietnam through PATH. But what we've seen is that the community engagement and the work that Hien is leading in Vietnam generates a lot of impact and learnings that then can be transferred to other areas like in Ghana or in Kenya, where we're also working. And to see the matchmaking and the exchange of views and learnings, I think is extremely valuable for us.
That's really helpful, James. And again, I think it highlights the different level at which Access Accelerated is working at, working much more at the global scale and working with multilateral organizations around global collaboration, which I think that's a point that I actually want to dive into in a minute, but I want to make sure Hien would love to learn more about, the role that partnerships plays in the work that you're leading.
Yeah, so like Javier and James already mentioned, so we see like NCDs have a very high burdens in any country in terms of morbidity and mortality. And in the low and medium middle income country, those burden is put a lot of pressures to the government, and especially for health sectors. And we see like partnership plays very crucial roles in helping the country to tackle with the NCD's burdens. And in Vietnam, we found the critical factors of our success in our strong partnership with the Ministry of Health. And that partnerships ensure the program sustainability and scalability of the models across the country. And moreover, as Jay mentions, we also see the public and private partnership is also very important. It helps us to expand our reach and increase access to the services. And a critical example of this public and private partnership is our partnership with the country's largest supermarket chain to increase the screening in this frequently visited location. And in the pandemic situations of the COVID-19, with those innovations, we still be able to screen for more than 40,000 people for the hypertension last year through such innovation in the partnership with the government and also with the private partnership. And in addition, we also promote the engagement of the non-health sectors, including the community volunteer network, which further expands the reach to our programs. So we see any opportunities that we engage, any players in the community to the NCD program is so important. And that is what we see the in-country partnership, and also we see our country partnership where we can work with the Access Accelerated and with the members, with the Access Accelerated members companies, that we can have a better chance to access not only the financial support, but also technical support, and even some such kind of essential drugs or equipments that are very important and helpful to the intervention in the country. Yeah, thank you.
It's really helpful. And an area that I wanted to dive deeper into is really the cross-sector partnership nature of the work that a lot of you all are leading, which, I think is at the core of Access Accelerated. And Hien, what you just mentioned in terms of the benefits that you get from these types of collaborations. And I know, Javier, you mentioned that you also partner with pharma. And so I'm curious, if you could provide a bit more specific color around those collaborations that you all have with the private sector, perhaps specifically for Hien and Javier, since the work that you do is directly in Access. I would love to get a better sense of what that relationship looks like, of what does the private sector provide to you all in the work that you're leading to be able to further your impact? And what do you feel like the benefit is for the collaborators that you're also working with, particularly as it relates to pharma or other private sector entities?
Yeah, do you want to go, Hen? Or I jump in?
I think, yeah, that sounds good. The mic's on you.
Yeah. Well, I think, I mean, we have to start from the perspective that all pharmaceuticals and all clinics, we want to we want to reach as many patients as possible. And one of the challenges in NCDs is that people is not getting care. So it's not like, even for me, it's like we are not even competitors within clinics. I think competition is the bad habits, the junk food. I mean, if we celebrate when someone decide to start care. So and just give a perspective, at least in Mexico, 80% of people with diabetes and hypertension are not doing anything. They went one time to a doctor and it's too expensive. They went to a government clinic. It might be like just take too much time and not the quality that I was expected. So we know that as humans, when we have difficult decisions, we typically defer the action. So they said, eventually I will do something. And then they get reminded 10 years later when they start getting blurry vision or when they get the pain in their legs. So when they start getting the complications, unfortunately. So one of the, I will say there are one of the main challenges the pharma have is I'm not getting, like, people is not getting treatment, is not getting care. And then if they start getting care, it only lasts for 2 months at most. And by the time they abandon the treatment. So we partner with them in the sense of, so one is, how can I build better programs for the patients? So better understand, like, from the price perspective, from the, like we have tested, like, can we do a annual fixed fee package for that include the insulin or medications? And what happened when the patient leaves the clinic, how they face with secondary effects or once you change the medication. And then the other one is just how you attract people. So just similar to what Dr. Liu mentioned, we partnered with supermarkets to set the clinics next to supermarkets. And so we try to be just like in the normal life of a person with diabetes, and we try to fit in there. So when they go for shopping, they can come to the clinic, they can go out, and we try to make it as convenient. So it's a specific example in the pharma is we've been testing from different support programs to just the screening programs to just more educational programs, as well as, for example, we many times we focus on the medical perspective, like, and we train doctors to be much better at what type of medication, what type of drug, the screen of complications. But not many times we train doctors in terms of the social skills. It's just how they face with the first-time diagnostic for a patient, or a patient that is reluctant to get insulin, to change to insulin. So we also partner in to develop more innovative training materials where we train doctors, nurses, nutritionists, psychologists, also on the social aspect of disease, and not to see as the only a patient that we have in the clinic, but to see it as a person, that we are just a small part of the whole life that they have. And so we also have partnered to develop these very innovative materials. And of course, the specific research like we have with AstraZeneca right now in terms of cardiovascular complications, and with Eli Lilly in terms of engagement, and etc.
That's great. So it's, again, it sounds like really working with pharmaceutical companies to help them improve the way that they're reaching patients for this disease state that a lot of patients don't seek treatment for. And then also figuring out creative ways to reach patients where they're at, which sounds like similar work that Dr. Lee is leading with the community model that you're pioneering. And so Dr. Lee, would love to learn more, a bit more specific color around the way that you've engaged with the private sector and how that's benefited your program.
Yeah, thank you. So as I mentioned earlier, the burdens in the country is very high, and more than 70, nearly 77 case death in the country caused by the NCDs, and for the hypertension is 50% of the patients, they don't know about their status. And with for the diabetes, it's more than 70% of the patients, they don't know their status too. So a huge the effort need to be invested in the NCD prevention and control. And like I mentioned earlier about the partnership in Vietnam at this moment, we try to build as a comprehensive partnership with the government, with the private sectors, and also non-health sectors. And we try our effort as much as possible that we can bring in the partnership. And the broad partnership means that we can reach more people and provide easier access to care. And we could not reach the people in the community level without such a support of our partnership.
Great. And James, the question it raises for me too is we'd highlighted that the work that Access Accelerated is leading is really connecting folks at this macro level. But then there's also the work that you all are doing on the ground. And so how do you balance that level of collaboration of supporting work like the work that Dr. Lee is leading with on the ground, actually at the community level with the global scale?
Yeah, thank you. That's a really good question. Just before I go to that, I just wanted to share a little bit from the Access Accelerated perspective around the more broader partnership. I think the way that we see our work is beyond the individual products that our company makes. So we really take a health system strengthening approach to work recognizing perceived and actual conflicts of interest, following the guidance of the ministries of the medical professionals and seeing how we can build the infrastructure or the trainings or different things as appropriate. I think that there's not a one-size-fits-all approach to partnership. I think we're really learning how to be a partner. And I think that that's why we see ourselves as catalyzing an assortment of different types of partnerships, be it from enabling a significant contribution to the World Bank to help them be able to move forward with their non-communicable disease agenda, or working with different community advocacy groups with the NCD Alliance down in the countries and the communities, or working with other big non-government organizations like PATH or the World Heart Federation. And I think for us, it's important to really kind of strategize about what are the different partnerships, how can we add value to the people living in the communities through the partnership, but then also how can we learn, set a baseline, identify learnings. Sometimes things work well, sometimes things can be improved. So that's why we work closely with Boston University and other academic institutions to really track the impact and then help us to articulate that and feed that back to help inform global dialogues as well. So one of the things that's important to me is I'm very concerned about health system fragmentation and different silos. So how can we create an environment that we have a clear and open discussion to make sure that everybody knows what everybody else is doing, so that we don't create confusion, and that we make sure we make the very best use of our limited resources. But then also, how can we make sure that global decision making and global prioritization, like the SDG process, is truly informed by local situations and local contexts. So these collaborations, we work to try to bring these different pieces back and forth. And then the other piece is, how do you take global decisions and make sure that they're translated into a way that local communities and local environments can actually follow the guidance and make the best use of these decisions. So this is where we try to find this middle ground to facilitate learnings.
That makes total sense. And it's such an important issue that you just raised around the fragmented ecosystem, because that's been a theme that we've been hearing throughout the course of the conversations on the Inclusive Innovation Exchange, that there are all of these amazing people doing really amazing work and innovations happening in little bubbles. And how do we connect folks to really catalyze that change so that, that we're not reinventing the wheel and that we're able to grow and expand. And I know in a conversation that the three of us had in preparation for this call, Javier, a point that you had brought up is how do you move innovations across regions, which I thought was also a really interesting point and speaks to a different component of the ecosystem.
Yeah, and I think I agree with James. It's so one is we think that and especially like diabetes, worldwide is very similar. So we innovate in our regions, but definitely, we should collaborate across regions. And it's very marked, like it's Latin America, or it's the US, or it's Europe, or it's Middle East, or South Asia. And I think the other challenge is as we partner locally, there are many situations locally that are challenged for the partnership. So let me say, like, we partner with the Mexico team, but the Mexico team has to deal with the partnership plus the commercial side and the specific of the country. So sometimes that could be an advantage, but also a disadvantage, because you depends on the specific priorities of the country. That if it's more on the broader scale, just like James are doing, is, you are in a global agenda. So it's not that easy to change. And I think that's great. The way you can help leverage the different resources and have a specific agenda across regions.
Thank you. And, as this conversation is spurring so many more questions for me, I'm sure that this is spurring questions for the audience as well. So please be sure to enter your questions in the Q&A, and Chantal will get to them in the next, in about 15 minutes. And one final question on the theme of partnerships, which ties to the conversation we were just wrapping up, around the potential future of collaboration. Are there collaborations that you all see that you're particularly excited about, or untapped opportunities in the non-communicable disease space that you wish that there were collaborations starting to form? And don't all chime in at once, whoever wants to start.
I'll jump in. I think that what I've seen the youth is something that's really important, and that I think is often overlooked when engaging globally, but also locally and in the communities. And, technology and things are changing so fast, and it's, the younger generation that knows better, and they have such an insight and innovative ideas that I think traditionally working through the big institutions in the United Nations and, global development agencies and things, it's the voice of the youth that's often overlooked. And for me, I know that it's difficult to formalize these kinds of collaborations, but if there was a way that we could pull that through better, I think that would add a lot. And then I'm looking at Heen, because I think that going with the youth component is also going with the elderly populations and the retired healthcare workers and community members. And one of the pieces that I like so much about the work that Heen is leading is that they do work with volunteers and retired community leaders, because it's this ingrained memory and approach that pulls things through as well. So I think if we could look at both sides of the spectrum, the youth, but then also the elderly population, I think that would add a lot of depth and opportunity for us.
That really speaks to the importance of patient centricity as well, of making sure that we're bringing all voices to the table. Javier, Dr. Lay, any thoughts there?
Yeah, well, I see for future potential, I would like to see a global franchise, like how we can scale and not invent the wheel, but just how we can rapidly scale and replicate the models worldwide. And the other thing is I think it's about patient segmentation and the patient journey. And there are other sectors that have developed a very unique understanding, and just like the finance sector. So if I think there is also for other sectors to partner with and to tackle NCD. So that's what I see. If you see what will be my my great ask is how we take it to 5,000 clinics worldwide, and how we became very good at understanding the patient journey and using data and digital tools to increase engagement.
Great.
Yes, as an additional comment echo to James said, we see the collaboration is a broader collaboration is a greater chance for NCD responses, and at this moment we focus on the hypertension and diabetes prevention control in the elderly groups who are most at risk. And I think what James says about youth, also very huge need that we can prevent the risk to become NCD patient in the futures. And you see when we see for the home population, so for NCD responses requires a lot of collaboration and multi-sectoral. I mean multi-sectoral collaboration, not only the health sectors, but also educations and also industry, etc. And also what the collaboration here is not within the one country boundary, but it should be expanded to others. Like a part, we also plays a very proactive roles in the NCD collaborations, where we can share the lesson learned from elsewhere, that a part have been implementing the NCD programs through the coalition, and also provides a technical support to subscribe the coalition. So the lesson learned, the success story can be shared widely to other similar settings.
Yeah, so really, again, making sure that we're leveraging lessons learned and spanning across boundaries to be able to catalyze that impact, as well as spanning across sectors too. I think that's a really important point, Dr. Lee, that especially with non-communicable diseases, it impacts so many components of our lives, and so many components of our lives impact our diseases. And so really making sure that we're bringing together different components of society. There's a theme that I wanted to transition to, beyond partnerships, which is the role of technology and the role of digital, since all three of you are doing really interesting, innovative work there. And I wanted to take a moment to be able to spotlight that, and I know, Javier, you highlighted some of the work that you're doing around data collection, and Dr. Lay, it sounds like you all are also doing work in that space. So can you talk about the work that you all are doing with digital technology, whether it's through diagnostics, prevention, maintenance, or monitoring? And perhaps, either Javier or Dr. Lay, perhaps we can start with you, and then James can finish with more of that macro level at the work that Access Accelerated is doing.
Sure. So I can jump first to
Perfect.
share what we have been doing in country right now. So we see we are in the we call a 0.4 generation, where we have a lot of a technology developed very fast, and the big data, etc. And we in Vietnam, we found a digital solution plays a very important roles to support for the NCD programs. And our digital approaches, including an electronic tracking system to ensure the long linkages to care, and to make it easier for healthcare workers and community health volunteers to support the treatment adherence. And we also have introduced digital apps for people living with NCDs. With that app, we can provide the right information on NCDs, generate the reminders for health checkups, and also provide a self-assessment tool for NCDs risk factors. So with this app, the people can be more empowered to the NCD responses. And also parallelly, we have developed a digital app for healthcare workers to help them manage cares and provide ongoing support and communication with the patients. And that app can help them very supportive tools when they go out to the community to do such kind of campaigns, or to do the household visit. It's very such kind of helpful apps for the healthcare workers. And like nowadays, the roles of the data for NCD becomes very important, and it creates a chance to apply technology, frontier technology. For example, the artificial intelligence, or we know that AI to target our intervention and reach more people more effectively, more targeted, and we are able to reach people who needs the most. Thank you.
Thank you.
I will just add that in our case, I will say 2 times we have in history in the healthcare space for digital. So a few years ago, the optics and the data transmission capacity as well as processing, it completely changed the environment in the way we were doing screening. Like we have an automatic for retinopathy software using AI. So that capabilities allow us to take photos and transmit a high amount of data and process it in a very short time, and completely shift the way we do diagnostics, AI, etc. I think one of the things that now the pandemic changed is that a lot of people have access to a video conference app. I mean, either Zoom or through WhatsApp, and that allowed for us the hybrid models where we can have patients coming into the clinic and patients doing certain type of the care as well through distance or through a video conference. So I think it's still early, but we were impressed by the percentage of patients that completely increased even adults, very low income, that you send in a link through Zoom and they can get access. So that's where we are really excited of how we can take advantage of the opportunity that patients now have the ability to get into a video consultation and see how. And definitely, I think the future is going to be hybrid. In when the pandemic, as the lockdowns start coming down, we were impressed that both the video consultation and the physical presence increase. And so it seems that one helped the other one. So that's what I see the future as well.
Yeah, telehealth, I think that will be a very important thing for the rest of healthcare. James, did you want to add any thoughts?
No, I mean, I think we agree as well in that we see digital technologies having a real meaningful contribution to public health priorities. And the examples that have been highlighted, I think, are really relevant. What we try to do is to identify different technologies that have a degree of credibility or proof to them, and then see how we can either help expand them in the region where they've been developed, or see how we can help translate them to other environments. Recognizing, of course, that there's no one-size-fits-all solution. And then I think another issue is that, there are areas where there is not stable internet or stable power. And I think it's important that these areas are not left behind as well. I think just another practical piece from my perspective, running a more of a global initiative, the amount of innovative ideas and suggestions out there is really overwhelming. And we're often overwhelmed by so many different tools and proposals and different things. And, we don't want to duplicate, we don't want to reinvent the wheel. And then it's also challenging for us to understand the credibility and to make sure that we're really working with the most reasonable and realistic partner. And so I think sometimes that causes delays to identify the actual best implementing partners in the technologies, because just the wealth of energy out there around digital solutions is really huge right now, but there's such a tremendous potential as well.
I think that's a very real watch out, and it's a very real consideration for us all, that there is so much innovation, and how do you sort through it, and how do you determine what will be the best partner? And I think that really ties together the two threads of the conversations that we've been having, of the role of cross-sector collaboration, the role of working with other players, and then figuring out the appropriate ways to do it. How do you leverage the tools and resources that each party is bringing together to improve health outcomes and to ensure that we're actually making quality of life better for people. I want to thank you all so much for this thoughtful discussion. It's been a pleasure learning more about the work that you all are doing. And I want to transition it over to Chantal, who's been managing questions from the audience. So we're so thrilled to have you all here, and thank you.
Thanks to you, Marissa. This has been really great.
Great. Yeah, this has been a really, really engaging discussion. And we have a couple of questions from the audience. So I'll start with a question that revolves around financing and funding. Javier, specifically, you had mentioned potentially a global health franchise. And the question is around where will this funding come from, or what's the sustainability model around this potential franchise? And I think for the others as well, if you can also speak to the funding behind your activities to provide care for NCDs.
Okay, well, in our case, we've been funded by impact investors, and we have also the IFC as well. And the model of the clinic's market-based approach is 100% out of pocket. The patients, even that they're very low income, pay 10, 15, or $10 a month, and to get access to care. So it's very market-based approach, and all the clinics are profitable. And however, here is the challenge, and that's why I mentioned the global franchise, because it's how high the margin. I mean, we know diabetes care typically is a low margin, and so we have three costs to consider: the cost of acquisition, the cost of care, and the retention, because retention, I mean, allows to get this extra margin. So when I get a lot of inquiries worldwide, and the typical question is, I set the clinic, but I'm not being able to acquire patients, or I set up the clinic, but my retention. And I mean, I think diabetes is very well known. We have great doctors, we have great drugs, we have great diagnostics. I think it's not, the problem is not there. The problem is specifically how you acquire the patient, organize care, and retain the patient. So we are investing. I mean, we have invested a couple of $1 million in software, in patient archetypes. And I know that for other projects, it's difficult to get a couple of million to do the same investment, to spend a few years learning. But then there are other projects that are ahead of us and of me, and they already invest a couple of millions. They already have the knowledge. So it's just how we work together in terms of leverage the customer acquisition knowledge and tools, the cost of care and retention. And if we are able to build that, then we can replicate very quickly, and with better margins, and of course with the funding. And I mean, it's as right now we're raising money to get to 80 clinics, and it's a matter of how we use as well, like tools or digital or learn or partnerships, because 2-3 points in your margin contribution, it's a huge, the economy of scale, I mean, factor is huge in these models. So that's the funding model.
Yeah. I mean, it's very, like you said, very market-based. And so you're hopefully getting to a place where it is sustainable on a global level. James?
Yeah, I'll just jump in really quickly about the funding piece. I mean, funding for global public health is, traditionally very tricky. Funding for non-communicable diseases is traditionally very tricky. And I think that we all have to keep top of mind, how can we make valuable interventions, but then make sure that they're sustainable? So for us, on behalf of the pharma industry, it's really challenging because, yes, we do have financial resources in addition to technical and in-kind contributions, but how do I make the best use of that? I can't, fix everybody in every situation. So I really have to be very thoughtful about making sure that before we make an intervention, that there is a whole degree of discussion around sustainability. What does the ministry say? Are the communities engaged? Because at the end of the day, the uptake is really going to be around if the people find it reasonable and it's translated into their context. And then additionally, big development agencies, the JICAs, the USAIDs, can we pull them together to really coordinate and then use my resources as a catalyst to generate the evidence where then they can take it further? And Heen, I think that you guys have some fantastic models more around the micro entrepreneurship and startups in the communities that I think from the sustainability piece is really exciting as well.
Yeah, thanks, James. With the support from the Access Accelerated, we have been pilot some model. I think the important the financial support from the Access Accelerated and also international partners can help us to initiate the good models. And with that models, we introduce to the government and also mobilize the participation, the support from a local social enterprises where they can have their own funding to contribute to such kind of for the screening services and also early treatment or case management. They can do such kind of services in the both for hypertension and diabetes care and treatment. And for the government, when we can show the good models to them, they can mobilize the more sustainable funding from the government, either through the social health insurance that can cover such kind of the testing and treatment cost, and also some regular budgets from the government also for capacity building, for health information system strengthening, etc. So you see we can see about some catalyst investment first that can somehow we can say create some initiatives and advocate for government to invest the funding for the long term intervention. Thank you.
Yeah, it's really engaging lots of stakeholders to make sure that that sustainability piece is really in place. So absolutely. We had another question around tools and technology for better data mining on NCD cases. And I'm not sure who is best to answer this question, so please jump in if you feel like you have something to speak to this topic.
Yeah. So let me share some experience from Vietnam. So we see in the past, we see a lot of difficulties to access the information of the NCDs. So the patient information, etc., is located in the different storage, like a server, etc., for hospital or some a primary healthcare center, etc. And it's very hard for the policy makers and also for the program managers can access to those information. So so I think when we can have the better information, information system for NCDs, is will have a lot from tackle to the burdens, to that NCD burdens. So we already supported the Ministry of Health to strengthen the NCD health information system through standardize the indicators, which indicators is good for the programs to be reported, and also developed the electronic checking system that can help the healthcare workers and health sectors to monitor the patient from diagnosis to the treatment and retains in the treatment and management. And also the apps we shared earlier, those apps can have to reach the more people as a community to get more information of the people who are at risk. And such kind of the information flows will be connect and store in a we aim that we can have such kind of the centers, somehow the national hub to store those information that can be provide access not only to to the policymakers, but also for the programs managers and also the end users at clinics, so they can access for some levels of the information and they can use the data for their daily work and can have them to produce appropriate the policy, the appropriate the health responses to the current situation in their locality.
And I would just add that, you know, oftentimes we see that there's not a lack of data or information, but it's about bringing it together and making sure that it's interoperable and being used by the right people. Is it being used for clinical decision making? Is it being used for policymakers? And there's a lot of energy that needs to go into the proper management of the data, and then also making sure that you know, individual patient confidentialities and things are protected. And this is something that's very top of mind for us as well.
Yeah, you are right, James. So the interoperability, patient confidentialities, and also like the authority to access the information is very important.
Great. We have a couple more minutes, so I'm going to try to squeeze in one more question of what opportunities and risks you see in scaling given your current models. Javier, do you want to go first?
Yeah, well, I think there's, I mean, it's a huge opportunity. Just, I think NCDs are going to be a huge burden in the future. I mean, just as we see the trends, and I don't think it's not going to change in the short term. So I think we should definitely put more resources, definitely put more. So I think the opportunities are just there. Unfortunately, also COVID-19 really hit the people with diabetes and hypertension because of the mortality rate. Unfortunately, in Mexico, companies are firing or not hiring people with diabetes and hypertension just because of the risk of also the complications from COVID-19. So I think that there's huge opportunities for collaboration. In terms of risk, I think is the main risk is just to be the same and eventually get and the huge burden. So I think we have to move quite fast and think more globally. And so I think that will be from my perspective.
Kian, do you want to jump in?
Yeah, sure. So like we see the biggest opportunity that we have found for scaling the programs is that we can increase access to care and treatment and management for the people living with NCDs, and it can have reduced the NCD morbidity and mortality in any countries, and especially in the like a limited resources country like Vietnam at this moment. And you know, like this is a best impact of any investment that I think like as the donors, partner, etc. They really care about how each single dollars, for example, will turn to the impact to the NCD morbidity and mortality. And we can see like our like a close partnership with the Ministry of Health will lead to the nationwide scale up, and with our sincere thanks to Access Accelerated, that we can have the support that can build the catalyst models, and we can introduce to the Ministry of Health, and we believe that in the few more years that models will be scaled up not only in the 3 provinces at this moment, but will be scaled to the whole nationwide. And we also see like as we scale up the programs, the public and private partnership will become more familiar, and that part can have bring the private sector engagement more in the NCD programs. And for some risks, you know, like every country in the world now suffer from the COVID-19 pandemics, and with that, the pandemic is further strains the budgets and impacted the prioritization. And like it calls to more limited resources to NCD at this moment. However, we think that at this moment for our country, so we will try to work best to can how can we mitigate any possible risk in the country, so we can still continue our effort for NCD programs. Thank you.
Great, and James.
Just very quickly, I agree as well. We're always looking for fantastic, innovative ideas to see how to scale in an evidence and credible way. And I think that's a great opportunity moving forward, particularly seeing how to harness digital technologies and new approaches. I do think that what's top of mind for us also, though, is to remember that there is no one-size-fits-all approach, and so that you can't lose the perspective of the individual person and the patient. And so while you're scaling, you must always be sensitive to the local contexts, and we work really hard to try to do that.
Well, thank you very much for sharing your perspectives. This hour always goes by so quickly, so that's all we have time for today, but I would really like to thank our panelists for sharing their experiences and fostering really novel partnerships to increase care.
And thank you to everyone for tuning in. Feel free to subscribe to our newsletter for future webinars and resources, and we'll post key takeaways from this conversation to our website. And stay tuned for the next episode. We'll be exploring the opportunities and challenges of using open innovation in public and private sectors to solve global health challenges. You can register on our website in the next few weeks. Thank you again, and thank you so much to our panelists. We so appreciate your time, and we'll see you all again soon.
Thank you.
Thanks very much to everyone.